I was diagnosed at 65.
37. Earlier than most.
Every 9 minutes, someone is diagnosed with Parkinson's disease.
And every one of them can turn to the American Parkinson Disease Association. Visit apdaparkinson.org to learn more and show your support today.
I think the community is looking for us to come up with some solutions, as we heard, here tonight, as well as we received a request from Sojourner House in regards to the some funds that they are requesting to address some of the domestic violence that we see here in our community. And obviously these two issues are not something that Woonsocket is alone in trying to tackle, but there are two big issues that I think we should be focusing on as a council, and we really haven't had much in-depth conversations about it. So I know we have a scheduled one for the 23rd, but if we can schedule these two things together at some point, I'd like to discuss them with both of these two entities to try to help alleviate the concerns that we have and the issues that we have here in our community. So, thank you.
Thank you.
Council President?
Yeah.
Two things. One, it is my belief, and I could be wrong, but the opioid settlement funds cannot be used for domestic violence. Secondly, the opioid fund settlement, the funds from the opioid settlement, I think I mentioned this to you before, and I think it would be very enlightening. I have been working with doctors from Brown University pertaining to opioid addiction, and we have met on multiple occasions. We as a community are very fortunate that Brown University and these doctors want to work with us. We are putting something together to present to the council, which would be, from their understanding, the first time that funds would be utilized in this particular way. It is not necessarily for, like buying items to pass out to say, call this number if you need help type of thing. Generally, people who have opioid addictions are not looking at a keychain or a bottle of hand sanitizer and deciding that they're going to call to look for help. They're generally probably not looking at a billboard or something like that. Oftentimes, from speaking with them, comes at a time when people are looking for help but don't have the means to get the help, or they don't have the funds to get the help. So the thought is that we could work with Brown University and the doctors, and when, say in particular, our Woonsocket Police Department comes into contact with someone who may have an addiction to alcohol or drugs, that we would offer them assistance, we would offer them inpatient care, and we would give them an opportunity that others may not be giving them because of the restriction of funds. And this way, they have a chance that others who have health care oftentimes have that ability, because health care will cover at least a portion of inpatient care. But if you don't have health care, more likely than not, you cannot afford the cost of inpatient care. So I think we're fortunate as a city. They're not working with any other municipality, and I think you'll be obviously very impressed by these people.
Thank you. Why don't we communicate with Councilman Mansur, and maybe we can set up that workshop for them to be here. I know Monday's workshop is probably going to be already jammed up with many things, but hopefully in the very near future.
What I will do is I will call and ask them if they could give us 3 different dates that they're available.
Sure.
And
then we'll go
we
from
could
there.
maybe accommodate the dates that they give to us.
But appreciate it. Thank you.
Council President,
Councilman Thompson.
there is no further business. I make a motion to adjourn.
Second.
Motion by Councilman Thompson, second by Councilman Mansur. All those in favor?
Aye.
Those opposed, the ayes have it. Thank you.